Our next segment is about hope in action to live well with NETs and NECs. All you need to know about symptom management, genetics and fertility, thrivership, and quality of life. Our first two speakers are Dr. Heloisa Soares, leader of the University of Utah NET Destination Care Program at Huntsman Cancer Center. She will discuss symptom management, and then Luz Chavez, a registered dietitian and certified oncology nutrition specialist at the University of Chicago Medicine, will focus on nutrition and neuroendocrine cancer.
Hello, everyone. Thank you so much for having me here. I'm Heloisa Soares. I'm a medical oncologist who focuses in neuroendocrine cancer at the University of Utah, the Huntsman Cancer Institute. And I'm very happy to be here with you guys on my birthday to talk to you about symptom management, because it's such an important topic that I see my patients and the caregivers of my patients trying to address and make everybody feels better. So because of that, we'll touch a little bit on some education about symptom management. Thank you. These are my disclosures. And why are we talking about symptoms in patients with neuroendocrine cancers? Well, because we see a lot. This is a survey that was done by INCA that tried to understand how much we see symptoms in patients. These are all the symptoms that we can see, from fatigue to abdominal pain to flushing, diarrhea, anxiety. So you can see here that you're not alone, and there are many patients living with the same symptoms that you are. Another important thing for everybody to know is that these symptoms sometimes are very broad and generic in a way, and there are several different diseases that can cause the symptoms. And because NETs are so rare, the healthcare providers and team players might not necessarily think about the symptoms as, oh, this is the tumor, the neuroendocrine tumor that is causing that. There might be a more frequent explanation. And this often leads to delay in diagnosis of patients if this is how they initially presented, or even the management when they already have established diagnosis that the symptoms could be generated by something else. For example, in the GI tract, the diarrhea and the abdominal cramping is often labeled as something related to IBS or a hiatal hernia, which is not uncommon, but in the patients with NETs, we also see diarrhea. The flushing or the rash can, if you don't know how to ask the questions, it might be interpreted, oh, you're just getting through menopause. If you have palpitations, someone might feel that you're having anxiety. If you are developing low blood sugars or high blood sugars, a provider that is not thinking about NETs might associate that with issues with your diet habits. If you're having mood changes, a provider might feel that this is related to depression and anxiety. And if you are having issues with electrolytes, when we check the blood, someone else might feel, oh, this is related to perhaps diarrhea, when it could be a completely different hormone that is causing the issue. So this is important to understand. But then let's take a step back and really focus on how we break down the symptoms, because we need to understand what is causing the symptom to try to fix the issue, right? And there's two approaches. One is understanding the symptom and going straight to address the symptom, to fix the symptom, or it's like, okay, we cannot really fix the primary issue, so we have to use a medication just to improve that symptom, but not eliminate the symptom. I tell my patients it's almost like a Band-Aid, right? We can make you feel better from the symptom, but I'm not necessarily fixing the symptom and making completely be gone. And then when we think about a cause, we have causes that are mechanical, that can be associated really of the tumor sitting on a particular place and causing issues because of the location. And we'll talk about symptoms that are related to the hormonal excretion that some of the neuroendocrine cancers can have, which is associated with a functional tumor. And it can also be a symptom related to a side effect of a treatment. And we'll talk a little bit more in detail about that. So let's think about mechanical issues and tumor burden. Here I have some figures that show about on your small bowel. Either in the first one, when you see a surgeon holding the gut there, there's a tiny little tumor that you can see there where it's a little bit more white. And that tumor is causing a little bit of on and off blockage. So a patient with that often have issues with sudden nausea, vomiting, and abdominal pain that can be severe with potentially some very strong diarrhea, and that can go away after a few hours or few days. How many times the patient may go to the ER and not have this detected? And then the patient can even have upper and lower endoscopies with their healthcare provider and not see these tumors because they're in the small bowel where the scopes don't get it. So this is someone that eventually, after having these episodes of on and off severe abdominal pain, nausea, vomiting, and diarrhea, there will be acute events that then will resolve. Eventually, the patient got diagnosed with a small bowel neuroendocrine tumor that was resected, and that issue resolved. In patients that are more advanced, they can develop these mesenteric masses that are fibrotic, and that can also be the rounded part here where the narrow is, and that can cause a lot of issues with obstructions on and off as well, and issues with the blood supply being drained there and then developing mesenteric ischemia. The picture of a surgical resection, you can see that there is an area of the gut that is darker than the rest. Is that this because this patient was suffering from mesenteric ischemia that led to issues with blood supply in the small bowel, and that eventually got resected. But that can cause a lot of pain, especially if that happens after a patient eats, and that can be related to mesenteric ischemia from the tumors that are anatomically sitting on your belly. And then in the last picture, you see a picture of a liver with a lot of liver tumors. And if they're pressing against the capsule of the liver, they can cause distension. And the patients will say that they have a lot of pain in the right side of the belly. And there are many reasons for that. But one of the reasons is that the tumors in the liver might be growing, causing distension of the capsule and causing discomfort. So is that a way that we can attack that for either resections or embolizations of these tumors to eliminate these issues? So these are some of the mechanical causes of symptoms in patients with neuroendocrine tumors, but there are many more. Then we can go to the hormonal symptoms, right? These are symptoms that happen because your tumor is producing a certain hormonal peptide that is causing symptoms. The most well-known is carcinoid syndrome. It's very much associated with serotonin and is associated with the flushing, the redness in the face, edema, abdominal pain, cramping, weight loss, wheezing as well. But there are many other hormones that can cause issues. For example, if someone is treating ACTH, then you can have issues with electrolyte imbalances. Your sugars will be very high. You can have a lot of facing edema and so forth. If you have a tumor in the pancreas that is producing insulin, then you have severe and life-threatening potentially episodes of low blood sugars. And there are many more that it can be seen. So not every single patient will have carcinoid syndrome, and not every single hormonal symptom that you have is because of serotonin. There are many more that can cause this. So this is super important to talk to your healthcare team so they can decide how to approach diagnosis and treat. And then finally, we have issues related to side effects of treatments. And one of the main ones that I think it's hard to see a patient that doesn't feel that a treatment is causing fatigue, right? Fatigue, the tumor itself can cause fatigue, but the treatments that we have can also cause fatigue. Some of them, the fatigue is only very shortly around the time of the treatment, but some of them can be very much chronic. Somatosine analogs, even though they tend to be very well tolerated by patients, can cause fatigue. And there's many other symptoms that have been associated with the treatments. Rash, for example, if a patient is receiving everolimus or sunitinib, or even temozolomide with capecitabine, they might develop a rash. they can develop diarrhea from all these drugs because your white blood count might be decreased from as a side effect of the treatment. You are much more susceptible for infections. You can have the redness in the hands and the feet, nausea, vomiting, headaches, including from somatostatin analogs. And I'm mentioning a lot somatostatin analogs because it's one of the treatments that we use the most, and certainly probably one of the treatments that patients will see first and might stay on the treatment for the rest of their lives, especially if they are functional tumors. And here is a list of described side effects that have been seen. A little bit of hyperglycemia. More rarely, we can see low blood sugars. Abdominal pain can be seen. A little bit of nausea, a little bit of diarrhea. Gallbladder stones, the fatigue, issues with malabsorption, and issues even with the thyroid. I say that the somatostatin analogs are hormones, and then they can make many of our glands in our body being lazy or hyperactive. So if it affects the thyroid, it can make your thyroid lazy and can develop hypothyroidism. If you affect your pancreas, it can even affect the sugars from up or down, or can affect how the pancreas produce enzymes that will help you to digest the food. And if you don't have that will be translating a symptom that's called steatorrhea, meaning that you have these mushy stools, they float, they can be oily, and you can have a lot of bloating with that as well. So let's talk about diarrhea because it's really the most common symptom that we have, and they can have so many causes. It's not just the carcinoid syndrome that is going to cause your diarrhea. So when you go and see your oncologist or whoever is taking care of you, and if they go and really keep asking you how is your poop, and they really try to understand how often do you poop, what's the consistency, does it float, what color, has the smell change or so forth, is because in their head they're trying to understand, is this a hormonal issue? Is this a mechanical issue because mesenteric ischemia can potentially cause the diarrhea? Or this is a side effect of the treatment that you are on? Or is this because we took so much gut that you have short gut? So it's important to be patient with your healthcare provider and really answer all these questions about how is your poop. Don't be upset with us if we keep asking. If you feel more comfortable not having a caregiver with you in the room, just ask your caregiver to leave for a little bit. I know that might be uncomfortable sometimes to talk about poop in front of others, but as your healthcare provider, it's our job to hear about your poop. And this is important, again, because we need to try to differentiate what is causing, because the diarrhea can be from this issue that is a side effect of the somatostatin analog, which is the pancreatic enzyme deficiency. And there are ways to diagnose, and there are treatments that we can do for that. If you have a large pancreas resection, or if your tumor is large in the pancreas, you might also have this issue because your pancreas function is not well. There are issues related to developing diarrhea because your gallbladder were removed, and then there are ways and medications that we can use if that's the case. There are issues sometimes because of post-surgery, you might develop an overgrowth of bacteria, and if that's the case, we can diagnose that and treat. There's obviously the hormonal issue as well. There's the issue of your gut being short and you don't have enough gut to absorb all the nutrients, and the food just pass through, and that becomes the diarrhea. There's the issue with the ischemia. If you have a lot of mesenteric fibrosis and that's causing your gut not be functioning well and not receiving enough blood supply, that can cause diarrhea. So that is why it's so important to have this open communication with your healthcare team in terms of what are the symptoms that you are experiencing, and really go into detail of how are the symptoms. So if you say this is after meals or not, or before meals, that is actually because in our head, we are trying to understand, and I'm thinking here about mesenteric ischemia or not. So again, very important to have this open communication, because there are ways to decrease the burden of the symptoms, if hopefully even eliminate once we understand them. So my take-home points here are: do not assume your symptoms are caused by a particular reason. There could be many reasons. There can be all these reasons together. How many times patients come to me with the referral, oh, the diarrhea is from carcinoid syndrome. And then when we do this detailed workup, it turns out it's not. So it's very important to discuss again with your healthcare team and really answer all the questions, and even volunteer more information. Be patient. Sometimes we're not going to be able to solve the symptom management improvement in one visit. It might take several visits to understand, especially if there are multiple symptoms or multiple causes of a particular symptom. And I will strongly encourage everybody to consider including a supportive care expert in their healthcare team. In some places, it's called supportive care. In some places, it's called palliative care, because you have a palliative care doctor or supportive care doctor or provider in your team. It does not mean that that's because you are terminal and dying. The earlier data has shown that the earlier we involve a supportive care provider on as part of your team, the better the patients will benefit. And there is not really this association that if someone is getting involved with supportive care is because they are dying. That's not the case. And I really want to take that stigma and this myth away from that. So consider including them. That's what I have. I really hope I was able to have a little bit of a breakdown of how to troubleshoot the causes of your symptoms and understand the importance of troubleshooting what is causing so we can treat it and not just use the band-aid approach. If you have nausea, I'll give you an anti-nausea medication. Perhaps if we identify what's the nausea from, we might be actually fix in the long term and not just give you a medication for the symptoms. So that's why it's so important to have that breakdown on your mind and your healthcare provider mind. Again, thank you so much, NETRF, for having me. You guys do a wonderful job for the community, and I'm really blessed to be part of your team of speakers today. Thank you.
Hi, my name is Luz Chavez, and I am the Manager of Clinical Nutrition and Diabetes Patient Education here at the University of Chicago Medicine. My specialty was also neuroendocrine tumors, and currently I educate new dietitians in that field. Today we will discuss nutrition specific for those with a neuroendocrine tumor diagnosis. Now, some of the advantages of making sure that you have proper nutrition during your treatments does include some of the following, and it is not all inclusive, but it's important to keep in mind that malnutrition is something that is occurring in high percentages among this patient population, specifically in the outpatient center. About 14% of those with GI NETs do have a diagnosis of malnutrition. For those who are admitted into the hospital, the rate is closer to about 25%. Now, proper nutrition is specifically going to help maintain the well-being of these patients, specifically through the maintenance of lean muscle mass, which will then help maintain and support your immune system. It's also going to help manage a lot of those treatment side effects, because the stronger you are, the easier it is to tolerate some of those side effects. And because of all of these factors, it does overall help improve your quality of life, and as a result, your survival rate as well. Diarrhea is a common symptom that patients with symptomatic or asymptomatic NETs will experience depending on the treatment that they are having to go through. So to cover some of the general recommendations that you may receive from a registered dietitian that can apply to anybody is first, eating small and frequent meals. By having a smaller volume of food going through your digestive system, this is going to be much easier for digestion. Another common intervention would be increasing soluble fiber foods. Now, fiber can be a little confusing. There is a difference between soluble and insoluble, but the main thing to remember is that soluble fiber is going to be those foods that are going to help thicken your stool. So to break that down a little bit further, that's going to be your pectin-containing foods, which does include applesauce, and then bananas. Oatmeal can also be thickening, as well as potatoes, but specifically your white starchy potatoes. That starch, which you will also find in white rice, is thickening. Whereas something like brown rice would actually speed up your stool transit time, which is not something you want to experience when you're already struggling with diarrhea. Another thing that you could consider if some of these interventions are not quite working is avoiding lactose-containing foods. And that would include not only things like yogurt, for example, but also dairy, milk products. You can also limit or avoid high-fat foods, which can be very aggravating when you're having diarrhea, as well as spicy foods. And these recommendations will be individualized to the patient because they may work for some and not for others. A key intervention with diarrhea, regardless of what is causing this issue, is to stay hydrated. At a minimum, you want to make sure you're taking in 8 to 10 cups of fluids daily. And in addition to that, you want an additional cup for each loose bowel movement that you have. When you're taking in large volumes of water to compensate for the diarrhea, you also want to consider adding an oral rehydration solution, which you can get over the counter and includes things like Pedialyte or even like diluted Gatorade. Now, what can add an additional level of complication for those with neuroendocrine tumors is carcinoid syndrome. So carcinoid syndrome is much more common in those with GI NETs and happens as a result of the tumor releasing serotonin. With carcinoid syndrome, you can see symptoms such as dry flushing, abdominal cramping, and even secretory diarrhea, which is very different compared to your everyday diarrhea. Secretory diarrhea differs in that it occurs multiple times daily. Many patients will often resort to restricting or eliminating food as a way to control their diarrhea, but if you were to attempt to do that with secretory diarrhea, you would notice that it would not stop this diarrhea from occurring. It can happen overnight while you're sleeping. And unfortunately, some of the more common over-the-counter antidiarrheals may not work for this type of diarrhea. And it can result in dehydration much faster. So electrolyte abnormalities can be common if you're not incorporating those oral rehydration solutions. With secretory diarrhea, you can still implement a lot of the common interventions that you would have for everyday diarrhea, such as consuming small, frequent meals, making sure you're staying hydrated, and incorporating those pectin foods that I mentioned on the previous slide. The different interventions for this would include low amine diet and a high protein diet, which I will get into more detail on a later slide. First, to address dry flushing. It's one of the most common symptoms that patients will experience with carcinoid syndrome. Now, like it says in the name, dry flushing means that there's no perspiration. So I've often had women ask, I'm going through, hot flashes because of menopause, what is the difference, so that they can identify that difference when they're keeping track in their symptom book. Just remembering that the dry flushing really does not have any kind of perspiration associated with it, and you may just notice your face feeling hot and flushed. Dry flushing can unfortunately be worsened by what we refer to as like the 5 E's, which is eating, epinephrine, your emotions, ethanol or alcohol, and exercise. Some nutrition interventions for dry flushing is going to include avoiding larger meals. So once again, small and frequent meals is going to be very beneficial for this symptom. As I mentioned before, ethanol or alcohol can be a trigger. Spicy foods can also be a trigger. And then in order to improve your outcomes, we want to make sure you're focusing on a high protein diet and a low amine diet. And one thing to remember when you're consulting with your physician or your dietitian is that your recommendations may look very different than somebody else who has a NETS diagnosis. So as I mentioned before, a low amine diet is a very common intervention when you have carcinoid syndrome, regardless of these symptoms that you're having. Now, amines, which does include tyramine and dopamine, are amines that are found in foods. Now, the significance of this is that tyramine and dopamine can increase catecholamine production. Now, what this means basically for those with a NETS diagnosis is that these amines increase secretion of serotonin. If you have an increase of serotonin, this is going to cause an excess of symptoms. So some of the foods that you could consider minimizing or eliminating are on this table. And I will say that it is not all inclusive. And for many patients, they may find that they do not need to eliminate or reduce all of these foods. It is very individualized, and each patient will find that we have to go through this list and kind of, trial and error, figure out which is the one that is influencing their symptoms the most. So once again, I'll definitely echo that it's important to meet with a registered dietitian to kind of help you through the process of figuring out what your triggers are. Now, I've also mentioned a few times that a high protein diet is really important. Now, this all goes back to that serotonin production. Tryptophan, which is considered an essential amino acid, which you can only find in complete proteins, and it's not made in your body. So you have to get it from outside foods. The tryptophan is a precursor to serotonin. So if your tumor is producing a lot of serotonin, that means that it is taking a lot of tryptophan from your body that you need for other functions. And one of the main things that you really need tryptophan for is not only to produce other proteins, but to produce niacin, which is really important. So some foods that do contain tryptophan are things like plant proteins, and then you also have chicken, turkey, your eggs, and then sunflower, pumpkin seeds, peanuts, and soybeans. Now, things to look out for with the niacin deficiency. I will say that one of the most common symptoms that those with NETs may see is going to be what we refer to as dermatitis. So that's going to be scaly brown patches that are on your arms and legs. And in my practice, I will say that I have caught this a handful of times. Now, if the niacin deficiency does go undiagnosed, it may progress to a more serious diagnosis, which we refer to as pellagra, which can include things like diarrhea, worsening diarrhea, dementia, depression, nervousness, and in very serious cases, I will say that pellagra can also lead to death. However, in our NETs population, we typically see that dermatitis occur. Now, a thing to keep in mind that if you're also losing weight and your appetite is really poor because of your symptoms and you're taking in very little food, this is only going to further contribute to the niacin deficiency. So it's really important to get that consultation with your registered dietitian so they can help with some interventions to prevent this. So treating niacin deficiency is actually pretty straightforward, I will say. You can treat with niacin supplementation, which would include niacinamide, about 20 to 50 milligrams twice a day. You can also find it sometimes in a multivitamin. But if you do have a niacin deficiency, we're going to recommend that high protein diet, that multivitamin, and a niacin supplementation. And some things that your dietitian may ask you about is if you've been experiencing a lot of weight loss, any kind of flushing, if you have a history of poor appetite. And then we'll also take a look at your labs to see if you have that elevated serotonin level that would be causing tryptophan to be used for that serotonin production. Now, some natural food sources of niacin that can be included in your diet is going to be some of those animal proteins, chicken, beef, and fish, and liver are going to be your highest sources. In terms of fruits, avocados, dates, and passion fruit are actually higher in niacin. And then in terms of veggies, you have your mushrooms, your broccoli, and your asparagus. And all of those can be incorporated into your diet, as well as some of the supplementation. Now, to kind of help consolidate all of these different recommendations, if you have symptomatic NETs, we want to make sure that you get a consult with an oncology dietitian. Most oncology centers do have an oncology dietitian on site, so you can request a referral from your oncologist to get plugged in with that person. If they don't happen to have an oncology dietitian, they will typically at least have a referral process in place. Once again, we want to make sure you're focusing on the high protein diet in order to minimize your risk of niacin deficiency, but also just to help support your immune system and maintain your muscle mass. Decreasing fat, because that can be very irritating and can worsen your diarrhea symptoms. You want to make sure you're staying hydrated as well. And if you have diarrhea, you want to make sure that you're including drinks with electrolytes, such as Pedialyte. You may want to consider decreasing added sugar, as that can worsen diarrhea, but also cause worsening in carcinoid syndrome symptoms. Can limit and avoid spicy foods, once again for the diarrhea, or just to reduce your risk of carcinoid syndrome symptoms. And then if none of these interventions work, that's where you want to work with your oncology dietitian and limit high amine foods to further improve your dry flushing and secretory diarrhea. And then, of course, considering a niacin supplementation just to make sure that we reduce that risk of dermatitis. Thank you.